5 signs of carotid artery blockage. 80% of strokes, the CVAs, could be prevented. Did you know that? One of the main risk factors is precisely the blockage of the carotid arteries, which are essential for the flow of oxygen-rich blood to the brain. So in this quick video, I will explain to you what the 5 most important signs and symptoms are that the body gives when these arteries are blocked. Remember that the last sign is the most important and can be identified early. Tell me in the comments, first, do you have blocked carotid arteries? And second, from which part of the world are you watching me? Remember, if you want to schedule an appointment with me, the link is in the video description. What are the 5 signs of carotid artery blockage? Numbness or weakness on one side of the body. If the blood flow to your brain is reduced, this can cause weakness or numbness on one side in the face, arm, or leg. Ask the person you are evaluating to raise both arms. If one arm cannot be raised or falls quickly, seek medical help immediately. This is one of the signs and symptoms of a stroke. Just like our second sign here, which is difficulty speaking or understanding. The areas of the brain responsible for language can be affected, resulting in slurred words or difficulty forming complete sentences. Ask the person to repeat a short sentence. For example, today the weather is nice. If they cannot do it or speak confusing things, seek help immediately. Or another way, you can ask the person to sing a song. If they cannot sing a song, this is also an indication to seek help. If their speech is slurred, you should also seek help. Third, blurred vision or temporary loss of vision. This happens a lot in a transient ischemic attack. Transient, the TIA, the lack of blood in the retina, can cause blurred vision as if it were a curtain or a shadow covering that eye. Even if the vision returns to normal quickly, this is a serious sign and needs to be evaluated. Why? A transient ischemic attack, which is a kind of, in quotes, a mini stroke, indicates that the person is at a higher risk of a stroke. Why? Okay, she has already had a mini stroke, so her chance of having a real stroke now is much higher. So are you seeing here that to prevent artery blockage, to control, to reduce, decrease, partially reverse the blockage of the arteries, it is essential to have a healthy lifestyle. And that's exactly what I talk about in my book, The Longevity Code, 101 Habits to Live Past. 101 years, all right? So here is the complete guide to a healthy lifestyle to prevent, treat, and reverse diseases, including carotid blockage naturally. The link to the book is also in the description and in the pinned comments. We'll talk more about it shortly. Fourth point, dizziness or loss of balance. When the blood flows to the cerebellum, now the part of our central nervous system responsible for balance is reduced. This can cause dizziness, imbalance, or even unexpected falls. This symptom is often mistaken for labyrinthitis or low blood pressure, but it can also indicate something more serious. And the last sign, as I mentioned, is the one we can observe more promptly. It is a sign that needs to be checked by a doctor, which is very important. It is the carotid root, the sound in the neck. The doctor will take a stethoscope, that little device he puts in his ears, and with which he listens to your heart, listens to your lungs, and will place it on your neck, looking for a sound we call a bruit, which is a turbulent flow caused by an obstruction in the carotids. This sign usually appears before other more severe signs and symptoms, such as weakness or loss of vision. But how are we going to diagnose carotid artery blockage? With a carotid Doppler ultrasound, which is a non-invasive test that will assess blood flow and detect blockages. A CT angiography can also be performed with which will provide detailed images of the arteries and will also identify the degree of obstruction. Another option is magnetic resonance angiography for people who, for some reason, cannot take the CT contrast. And the last option is arteriography, an invasive test used in more severe cases to plan more invasive treatments, such as surgeries. So what are the treatments for carotid artery blockage? Let's go. Mild cases, that is blockage, less than 50%, 10%, 20, 30, 40%. What is the treatment? Lifestyle changes. Read my book, Longevity Code. It will teach you exactly what you need to do. So it's healthy eating, regular physical exercise, stop drinking, stop smoking. If necessary, you will have to take some medication to control diabetes, blood pressure, cholesterol. But the best remedy for diabetes, blood pressure, and cholesterol is also in the book, okay? So, for mild cases with blockage, less than, below 50%, lifestyle changes. Severe cases with blockage greater than 70%, surgery may be indicated. And endarterectomy to remove the fatty plaques. So the doctor will open your neck, dissect the tissues until reaching your carotid, where he will, literally, with his hand, remove this excess fat. Another option is angioplasty, which involves placing a stent to open the artery and restore blood flow. Signs of carotid blockage can be silent or appear temporarily, transiently. Even if these signs and symptoms disappear quickly, as in the case of a TIA, a transient ischemic attack, they are a warning that a stroke may be on the way. Therefore, get your exams done, seek medical attention, and maintain a healthy lifestyle, especially if you have high blood pressure, diabetes, or high cholesterol. And when you go to the doctor, ask them to listen to your carotid artery, because this examination can indicate something. But that's it, folks. Let's go. You see a person who is 60 years old, who is overweight, sedentary, eats poorly, smokes, drinks. We can already assume that this person has some degree of artery blockage, not just in the carotids, but in the arteries throughout the entire body. All right? Look, share this video, like this video, to help those people who don't have access to doctors, hospitals, health plans, and who only have access to information. Let's at least ensure that this quality information reaches these people and helps them to have better health. All right? Remember that to purchase my book is very simple. It's in the video description and also in the pinned comments. Physical version, $79.90, with shipping included for all of Brazil, and the digital version for only $39.90. And by purchasing either the physical or the digital version, you will also get a super discount if you want to buy my other book, Secrets of Circulation, which will also be very good for you if you have clogged arteries. Deal? Don't go. Stay with me and watch this video here, where I talk about fruits that improve circulation, and this video here, where I talk about signs and symptoms of liver disease. See you soon. Peace.